Hi, and welcome to the Healthy Life Approach podcast. I'm Kristen Beasley, and I'm certified as a functional medicine, nutrition, and brain health coach. Today, we are talking about something that influences millions of women, but is often not discussed openly: how menopause changes your brain and what the latest science suggests you can do about it. Stay with me until the end of the podcast, as I have a free gift to share with you. This episode is being brought to you by Function Health. They offer extensive lab testing, giving you the data you need to partner effectively with your healthcare team. Use code KBeasley10 at functionhealth.com. The link will be in the show notes. I aim to reassure you that this sponsorship does not influence my recommendations or the science-backed information I share. My goal is to provide you with well-rounded, supportive content. I'm going to tell you a little story about brain fog and perimenopause. I was standing in the hallway at work, asking about a colleague I'd worked with for a year, and I could not remember her name. This was completely blank, a total blank. I smiled, made small talk, and I walked away feeling mortified. And I wondered, is this how it started for my dad, who died from Lewy body dementia? That wasn't the only thing that was slipping. My American Sign Language, a skill I'd used professionally for 25 years, was also slipping away. Words I had signed thousands of times weren't flowing to my hands the way they used to. The fluency was gone. The systems I had built over the years to manage what I now believe is undiagnosed ADHD, my calendars, routines, and mental tools, suddenly stopped working. It felt as if the supports I depended on disappeared, and I hadn't realized how fragile everything was. I believed I was losing my mind. Turns out, in a way I was, but not in the way I feared. No one told me this, and I only discovered it after years of research and working with my hormone specialist. My brain was lacking the very hormones it had relied on throughout my entire adult life. Now, if you've been following the news, you might have seen the headlines about the FDA removing the black box warning from hormone therapy products. It's now just a boxed warning. Today, I want to put politics aside. It's important to recognize that doctors, researchers, and medical groups have been advocating for these changes for over 10 years. This isn't about any administration. It's about 20 years of research finally influencing policy. And more importantly, this is about your brain, your memory, and your ability to think clearly and feel like yourself again. Allow me to explain this in clearer terms. The risks and benefits of hormone therapy are real and must be discussed with your licensed healthcare provider, considering your personal health history. This isn't a decision to make based on headlines or what worked for your friend. It is an individualized conversation. To help in these discussions, consider starting with the following questions. Given my personal and family medical history, what are my specific risks and potential benefits? What are the different types of hormone therapy available, and how do they vary in delivery and form? How long does it take to usually find the right approach and dose for me? These conversation starters can help ensure you and your provider explore all aspects when discussing your options. So let's talk about blood clot risk first, because this is one of the concerns that comes up frequently. Here's what many people do not realize. There are numerous factors that increase the risk of clots that have nothing to do with hormones. These include your age, particularly over the age of 60, a sedentary lifestyle or prolonged immobility, genetic factors, especially the factor V mutation, recent bone fractures or surgery, smoking or vaping, obesity. The main point is that clot risk doesn't just come from hormones. It is a basic risk influenced by many things, and hormones are only a part of it. Now, let's address the breast cancer fear, because I know that's the big one for many of you. A woman's lifetime chance of developing breast cancer by age 90 is about 1 in 8. Many women who get breast cancer have never used hormones. It's also important to know that other lifestyle factors can raise breast cancer risk. Drinking 1 or 2 alcoholic drinks daily has been linked to increased risk. Smoking also raises risk. Obesity increases risk, especially after menopause, where it is associated with a higher breast cancer risk than hormone therapy use. I want to give you a framework so that when you talk with your doctor, you see the whole picture, not just the parts that make the headlines. So now what I want to do is talk about absolute versus relative risk and why the Women's Health Initiative study headlines got it wrong. When the Women's Health Initiative, or WHI, study results made the headlines in 2002, they loudly announced that hormone therapy raised breast cancer risk by 26%. Women across the country and their doctors panicked. Millions stopped taking their hormones overnight. But here's the thing, that frightening 26% was a relative risk figure, which completely masked what was really going on. Absolute risk is your true, actual chance of something happening. It is the clear answer to how likely is this to happen to me. Relative risk measures how likely an event is to happen to one group compared to another. It asks how much more or less likely is this in one group compared to another. Here's the WHI example that changed everything. In the WHI study, out of 10,000 women not taking hormones, about 30 developed breast cancer annually. Among 10,000 women taking combined estrogen and progesterone, around 38 developed breast cancer each year. The relative risk calculation is 38 divided by 30 equals 1.26, or a 26% increase. That's the alarming headline number. But the absolute risk tells a very different story. 38 minus 30 equals 8 additional cases per 10,000 women each year. That's less than 0.1%. In other words, 99.62% of women not taking hormones didn't develop breast cancer that year. Similarly, 99.62% of women taking hormones also didn't develop breast cancer when rounded to 2 decimal places. Same data, completely different emotional impact. This is exactly why understanding both numbers is so important for your health decisions. When someone tells you a treatment doubles your risk or increases risk by 50%, your next question should always be, what is the absolute risk? What are the actual numbers? Doubling a 1 in 10,000 risk still results in a 2 in 10,000 risk, which remains very small. But double the risk sounds frightening. The WHI headlines frightened an entire generation of women away from hormone therapy that could have protected their brains, bones, and quality of life. Many researchers now believe this contributed to an increased rate of dementia, osteoporosis, and heart disease in women who stopped or never started appropriate hormone therapy during their window of opportunity. The bottom line is this: relative risk shows how strong a connection is, while absolute risk shows the actual effect on people. You need both to make smart health choices and see past headlines designed to grab your attention, not to help you decide. In 2002, the Women's Health Initiative study made those headlines, warning that hormone therapy increased risk of breast cancer, heart disease, and stroke. Women panicked. Doctors stopped prescribing, and overnight, hormone therapy went from widely recommended to widely feared. But here's what those headlines didn't tell you. The average age of women in that study was 63. Most were more than a decade past menopause. Only about 3.5% were in their early 50s, the age when most women actually start hormone therapy. It would be like testing sunscreen on people who are already badly sunburned, then saying it doesn't work. The study's timing was off. By 2013, researchers led by Dr. Joanne Manson at Harvard, one of the WHI's principal investigators, published a reanalysis in JAMA showing that women aged 50 to 59 had no increased risk of heart disease from hormone therapy. This confirmed what scientists call the timing hypothesis. Howard Hodis at USC published the ELITE trial demonstrating that women who began hormone therapy within 6 years of menopause experienced 40% less atherosclerosis. In 2017, the North American Menopause Society issued a statement endorsed by over 30 international medical organizations, including the American College of Obstetricians and Gynecologists and the International Menopause Society, stating that the benefit to risk ratio is most favorable for women under 60 or within 10 years of menopause. Dr. Rachel Rubin, a urologist at Georgetown, publicly stated, "We have been begging for these changes for decades now." It is research that has been growing for 20 years as policy has taken time to catch up. So if you're hesitant because of who announced it, don't let that stop you from having an informed conversation with your healthcare provider. The research speaks for itself. If you want to pursue hormones, that is your decision with your healthcare provider. If you choose not to, that's also a decision made after an educated discussion with your doctor, and that's perfectly okay. Now let's discuss why this matters specifically for your brain, because that brain fog you're experiencing, it's not all in your head. Your brain is an estrogen-dependent organ. Dr. Roberto Diaz-Brenton at the University of Arizona has conducted fascinating research showing that during menopause, brain glucose metabolism shifts from 20 to 25%. She describes it as the brain activating a starvation response. Those hot flashes, they're actually a visible sign of these metabolic changes occurring in your brain. The study of the Women's Health Across the Nation, or SWAN, tracked over 2,000 women and found that 44% of women in perimenopause reported forgetfulness, compared with 31% of women in premenopause. About 60% of women in midlife experience memory complaints during this period. Here's the reassuring part. For most women, this cognitive-related dip is temporary and usually resolves after menopause. However, the window of opportunity to protect your brain long-term may not stay open forever. A 2023 meta-analysis in the Frontiers of Aging Neuroscience reviewed over 50 studies involving nearly 800,000 dementia cases. They found that women who began hormone therapy in midlife within 10 years of menopause had a 32% lower risk of dementia with estrogen-only treatment. Women who began hormone therapy after 65 experienced either no effect or an increased risk with certain types of therapy. Timing matters. When you start, it makes a difference. I'd like to share more of my story because it shows why this matters so much to me and why I strongly believe in women being informed. After my hysterectomy, I was not offered hormone therapy. This was still during the shadows of those WHI headlines, and doctors were cautious. When I started experiencing hot flashes and called my doctor, he said, once your ovary wakes up and realizes it's alone in producing hormones, it will catch up. The hot flashes eventually went away. Years later, I started experiencing night sweats, but no one warned me about everything else that was on the way. I developed severe hip and joint pain, so intense that it made me quit a job I loved because it involved too much travel. I also had frozen shoulder twice. Once, while cleaning out my mother's house after she passed away, I tossed something aside and immediately doubled over in pain. That led to rotator cuff surgery. Researchers have introduced the term musculoskeletal syndrome of menopause because over 70% of perimenopausal women experience these symptoms. Estrogen receptors are present throughout your joints, cartilage, tendons, and ligaments. Dr. Jocelyn Wittstein at Duke found that postmenopausal women not on hormone therapy had a 99% greater odds of developing frozen shoulder compared to those who did. I ended up with two, one for each shoulder. And all those years, no one connected the dots. All I ever heard was menopause equals hot flashes. Nobody mentioned the joints. Nobody mentioned the brain fog. Nobody talked about any of this. My mother never talked to me about her menopause since her generation tended not to discuss it openly, but I remember her hip catching. She had used oral estrogen for a while after her hysterectomy until she developed a skin reaction and stopped. She never tried any other treatment. Looking back, I wonder how things might have been different if she had had other options or more information. It took nearly 12 years after my hysterectomy to find a hormone specialist who truly listened. It took about 6 to 9 months to find the right doses. There is no magic pill that makes you feel better overnight. Nutrition and lifestyle are also important. Hormone therapy is just one option as you age. Choices like regular exercise, good sleep habits, and brain training can also be very helpful. It's best to take a comprehensive approach to managing menopause symptoms. We'll discuss more options and resources in future episodes. After discussing the risks and benefits with my doctor, I began to take estrogen. Since I didn't have a uterus, we could wait before adding progesterone, which let me see how each hormone affected me individually. Estrogen gave me back energy. It started helping clear my brain fog. I noticed my blood glucose levels, which I had been tracking with a continuous glucose monitor for 3 years to assess my insulin resistance, began to stabilize. Research shows that hormonal changes during menopause contribute to insulin resistance, and hormone therapy has been shown to reduce new-onset diabetes by 20 to 30%. Then we added progesterone, and my sleep improved. I had been waking up in the middle of the night, anxious about the alarm clock going off. That stopped. Progesterone is metabolized in the liver into allopregnanolone, which binds to the same brain receptors as anti-anxiety medications. It is sometimes called nature's Valium. Research shows it shortens the time to fall asleep and increases deep restorative sleep. Then we added testosterone, and that's where things got really interesting. Yes, testosterone helps with libido, but it did so much more. My motivation returned. The mental systems I had mentioned earlier, the ones that had stopped working, started to come back. My fluency in American Sign Language also returned. When you've been signing for 25 years and suddenly words aren't coming to your hands and then they come back, that indicates something deeply meaningful is happening in your brain. Dr. Susan Davis at Monash University, the world's leading researcher on testosterone in women, has conducted studies showing that testosterone improves verbal learning and memory in postmenopausal women. I'm not sharing my story to advise you on what to do. Hormone therapy might or might not be suitable for you. That's a decision only you and your healthcare provider can make. I'm telling you because no one told me, and I wasted 12 years of joint pain, brain fog, and struggling with systems that used to work. Now, I want to talk about something that isn't discussed enough. What happens when menopause intersects with ADHD? I'm self-diagnosed as having ADHD. Looking back, I think my father had it too. People often said they would talk to him for an hour and realize he never answered their original question. I am the same way. For years, I built detailed systems to manage my mind, calendars, routines, and ways to organize information. These worked until suddenly they didn't. When perimenopause hit, it was as if those systems suddenly had no foundation. Everything I relied on to stay organized and focused just stopped working. It turns out there's science behind this. Attitude magazine surveyed over 4,000 women with ADHD and found that 94% reported their symptoms worsen during perimenopause and menopause. 43% received their first diagnosis between the ages of 41 and 50, and 70% described brain fog and overwhelm as life-altering. Now here's the connection. Estrogen boosts dopamine activity in your brain, and ADHD is essentially a dopamine regulation problem. So when estrogen drops, it's like taking fuel away from an engine that was already running low. Dr. Patricia Quinn from the National Center for Girls and Women with ADHD explains it this way. When hormone levels decrease during menopause, many women report that their ADHD symptoms worsen and that their medications don't seem as effective. If this strikes a chord with you, if you've built your life's systems to cope, and now those systems are failing, please know you're not alone, and that there may be options worth exploring with your healthcare provider. This isn't about being broken. This is about your brain chemistry changing and the support you deserve through that change. So where does this leave you? I want to be clear about my role. I am a health coach, not a doctor. I can educate, share research, and talk about my own experience. But I can't prescribe, and I wouldn't want to. Every woman's situation is different. Your medical history, risk factors, symptoms, and feelings about medications are all personal. These decisions are deeply individual. What I can tell you is this: you deserve to have the conversation and to know that science has evolved dramatically since those 2002 headlines. You should also know that medical societies around the world have been supporting better information for over a decade. If you find that your provider isn't familiar with the current research or dismisses your concern, that's valuable information too. Dr. Mary Claire Haver has a great video I'll link in the show notes about how to approach your doctor about hormone therapy and how to advocate for yourself. Here are a couple of example phrases you might consider using in your conversation. I am concerned about the risks and benefits of hormone therapy given my personal history. Can you help me understand the latest research? Or I feel that my symptoms are not fully being addressed. Can we investigate other possibilities or consult current guidelines together? These scripts can help support you when you're speaking with your healthcare provider. You are the expert of your own body. A good provider will partner with you, not dismiss you. For too long, women have been told that what we experience during menopause is just something to endure. Hot flashes, brain fog, joint pain, anxiety, sleep disruption. We're just supposed to push through it. It's natural after all. It's just a part of getting older. But you know what else is natural? Having information, making educated choices, and championing our own health. The FDA's recent decision to remove the black box warning isn't about politics. It's a correction and a long overdue sign that the evidence has changed. Women deserve accurate information to make their own choices. The research shows that for many women, particularly those in early menopause, hormone therapy may offer protection for their bones, their hearts, and their brains. It shows that timing matters, that different types of hormones have different effects, and this is not a one-size-fits-all situation. Look at Dr. Joanne Manson's research at Harvard in 2013. Look at the ELITE trial in 2016. Look at the 30-plus medical organizations that endorsed the North American Menopause Society's position statement in 2017. This science has been building for 2 decades. Don't let anyone, no matter their political views, keep you from the information you need to make the best choice for your health. I think about who I was in that hallway, unable to remember my colleague's name. I think about all those years of joint pain and brain fog, not knowing that there might be answers. I think about my mother's hip catching, her stopping estrogen, and never exploring alternatives. I don't want that for you. I want you to have the information I didn't have, and I want you to ask questions, and I want you to feel empowered to advocate for yourself. Because your brain matters, your quality of life matter, you matter. Before you go, if you're struggling with brain fog or sleep issues and you're tired of being told it's normal aging, I want you to have my free guide, The Brain Fog Solution, your guide to mental clarity during menopause. It covers which foods actually help rebuild your brain cells, the sleep strategies that made a real difference for me, and how to have better conversations with your doctor about hormones. Download it for free at the link in the show notes. Thank you for spending time with me today. If this episode spoke to you, please share it with a woman who might need it. If you have questions, contact me. I'd love to hear your story. See you next time. This is Kristen Beasley reminding you your healthiest life is within reach. You need the right information and the determination to follow through. New episodes drop every week. Subscribe to the Healthy Life Approach podcast wherever you listen to podcasts. This podcast is for educational and informational purposes only and is not intended as medical advice. Be sure to consult with a qualified healthcare provider before making any decisions about hormone therapy or any medical treatment. Every woman's situation is unique, and treatment decisions should be made in partnership with your healthcare team based on your individual health history and needs. For further information and help, please check out the show notes below or visit our website where I've included all the studies and expert references mentioned here.
This podcast may contain affiliate links. As an Amazon associate and affiliate for different brands, I earn from qualifying purchases at no additional cost to you.